Hi, everyone. I'm Dr. Ron Miller. I'm the owner of Pursuit Physical Therapy, and I wanted to go over with you today what telehealth is, what does it entail, and how can we help you with that. So, I know we're going through a lot of crazy times right now, but whether you're out of state or whether you are quarantined or whether you're staying at home, I just want to let you know that we can help, and there's no reason to suffer in pain and to just deal with it. There's still stuff that you can do. And this is why we're providing the telehealth option now, where we can treat you virtually at home. So I want to go over a few things today just to explain to you what it actually entails, how can we help you, and then what are you going to get with a telehealth consult. So the first question is, how does telehealth work? What should you expect? So first off, once you complete the form below, you know, your concierge specialist will actually get that feed and they'll be in touch with you and they'll make sure that you're matched with the best physical therapist that specializes in your type of pain or injury. Then she's going to email you the new patient paperwork. It's a detailed history and it'll kind of allow you to tell your story a little bit and kind of go through the past medical history, what things make your pain worse, what makes it better, and you'll fill out that form and you'll send that back to us. And then one of our therapists, myself or Monica or Carrie, will reach out to you and we'll schedule a telehealth consult. In your email, you'll get a simple link that you just have to click on, and we'll be able to go virtually side by side live and be able to ask questions. This is when the eval starts. A good evaluation can solve the root cause of your problem by identifying patterns. There's certain patterns that your pain's going to present, and there's clinical things that we can do also that, kind of like if it sounds like a duck, it quacks like a duck, it's probably a duck type thing, whether it's a herniated disc or whether it's a pinched nerve or whether it's some sort of shoulder impingement or Achilles tendonitis, things follow patterns. And this is the key of what we're going to try to do with your evaluation is identify what pain or what pattern your pain is presenting in and what does it sound like, what does it move like, what makes it worse, what makes it better, and see if it matches the patterns that we see in the clinic. A good evaluation should be able to diagnose it just by taking the history, by asking the right questions. You should be able to get or pinpoint maybe the most common cause of that, or even what are the top three things. And then if you're uncertain, you can always look at response to treatment. So after we go through the eval, that's going to probably take up the majority of the time because part of the things of what we really want to do here is solve the root cause of your pain. We're not just going to do some standard cookie cutter approach. The goal is to solve the root cause of your pain. So after the evaluation is done, then we'll go through some treatment where if you have either a laptop or even a cell phone, you'll be able to step back and we'll be able to go over some repeated motion testing, possible some stretches, some strengthening exercises, and see your response to treatment within session to make sure that it's making you feel better. We'll be able to do treatment right virtually on day one because after the eval's done, you're going to get a video-based home program that's customized based off of your virtual evaluation. So let me show you a little bit more here. That I'll share my screen. This is the same platform that we're going to do the consultation on anyway, but I'll share my screen so you can see what I'm actually looking at to show you that. So why am I even, this popped up, why am I even credentialed to even say this? So Pursuit Physical Therapy is the #1 rated clinic. If you don't know much about us, you can go to the website and look at some of the testimonials and see what people are saying about their results that way. If you don't believe the website, you can go to our Google business listing, our Yelp listing, or even our Facebook listing and see what other patients are saying about their results to make sure that you're comfortable with coming to see us virtually this way. But what I wanted to do is show you after the evaluation, this is what you're going to end up getting. Okay, let me get out of this. So we have an assortment of videos that we store on YouTube. So it's time to take advantage of technology where we've categorized them on the back end into all sorts of playlists. So we have a hip pain one, we have a low back pain one, we have shoulder one. So we have our program on the back end. All of our home programs are video based. So what we'll do is after the actual eval, Okay, so say I'm seeing you for back pain. Let's say sleep with legs elevated. You'll see something like this. And then we'll try saying using heat for 20 minutes, laying prone on elbows. And this is all stuff that we'll go over. Mobility stuff. Say you have a herniated disc. Okay, prone press ups, 1 set of 10 every hour. And then we're going to do right lumbar trunk rotations, 3 sets of 10. Okay, so this is an example. This is more the mobility work or the stretches and flexibility that you'll do at home. So and then we categorize it by strengthening. So say I want you to do single leg heel strikes. For a perfect example, if you have a herniated disc, we don't want you bending forward. It pushes the herniation out. So we want everything in a neutral spine. So maybe I'll add in single leg heel strikes, and then I'll give you another one. Let's say we do clams with a loop, 3 sets of 10. So now you'll get a detailed home program exactly like this. But what I'll do on the back end after the evaluation, we're going to go over this and say, I'll categorize and customize your individual home program that you can get started with to help provide relief at home. So what we do is we'll highlight that video, we'll design this one, we'll look for lumbar trunk rotations. So we've tested some of these things during the virtual consult to make sure that they provide relief for you. But then we'll design a customized home program that you can do over the next couple of days to start treating yourself at home. So you should easily know whether this is going to help or not. And then after this, after I complete this, I'll end up sending it. We'll put your email address here. I'll just send it to myself. It'll be classified as initial home program. And then you'll get a customized home exercise program exactly like this based on how you present. And then I'll send it to you. And then you'll have 24/7 access to me. You'll be able to communicate with me via email. You'll be able to send us text messages to follow up to make sure that you're responding good. And then we can design a program there. I just got it right there. So um, that's kind of how like the telehealth session works. And a lot of people also ask is your diagnosis going to be accurate? So with a good eval and a good history taking and asking the right questions, there's a high probability that we'll be able to diagnose you just as well as if you were coming into the clinic. You don't need the manual therapy every time. Yes, it probably helps, but at least this way we can ask the right questions. You'll get the new patient packet early, and I'll guide the eval and I'll ask the right questions so I can identify those pain patterns so I can help diagnose um, what type of pain you're having, what is the diagnosis, and what's the best way to treat it virtually and stuff like that. So this way, whether you're in another state or whether you're staying at home, we'll still be able to help you, give you an accurate diagnosis, and kind of design a specific plan of care based on how you present. And then after that eval, we can design a plan on whether you need to follow up with me once a week or every 2 weeks or whatever it takes to get you the best outcome. So this is a little insider's look of how the evaluation is going to go. Start off with the whole process of the introduction and getting the email sent to you with the new patient packet. Then we'll sit down and actually do the telehealth consult where we'll do the evaluation. And then you'll get some treatment started on day one. And then you'll also get a video-based home program that's virtual that we can make changes here. We'll be able to reassess and communicate via email and text and stuff like that to make sure that you're getting the results that you want. So if you have any questions, you can send us an email or give us a call. Otherwise, fill out the form below, and we'll see you on the other side in the virtual world. And we just want to let you know that we are here to help. So there's no need to suffer in pain while you're staying at home right now and enjoying this quarantine. But if you need us, we are here to help. And I hope to see you on the other side. See ya.